A new mask mandate is in effect in the Bay Area starting today.
More communities in California are masking up.
Health officers in 7 Bay Area counties are once again requiring masks indoors.
This is a time to be cautious. While the vaccine is highly protective, it's not 100% protective.
From KCBS Radio, I'm Matt Pitman. To go deeper inside this story, I wanted to connect with KCBS reporter Kathy Novak. Kathy was on hand yesterday as health officials from the 7 Bay Area counties made the announcement.
There is evidence that vaccinated people can spread the virus to others. That is why everyone must wear face coverings when in public indoor settings.
A simple step, wearing a mask indoors, to provide one more layer of protection for everyone.
Let's just start right there, Kathy. In the Bay Area, who does this mask mandate cover?
Most of the Bay Area except Napa and Solano counties. If you want to put it another way, the list is the counties of Alameda, Contra, Costa, Marin, San Francisco, San Mateo, Santa Clara, Sonoma, and the city of Berkeley. These are the health officers that all signed on to this mandate, saying that everyone has to go back to wearing masks indoors when in public settings.
And there is that word, mandate. I think we'd gotten accustomed to, at least in the short term, the word recommendation, but we are back to mandate. And that just kind of speaks to where we are, obviously here in the Bay Area, but really around the country with COVID-19 and certainly the Delta variant.
I think that the health officers were hoping that they could keep it to a recommendation when it started as a recommendation here in the Bay Area. I think behind that was giving businesses, in particular agency, to put up signs on their own windows if they chose to say to their customers, we request that you wear a mask when you come inside. They said they would see how that went when it was just a recommendation before going through with a mask mandate. Now we're seeing this taken a step further, that it is required. And we did see this coming. This was sort of reflecting what we've already seen from the CDC, from the state. And it reflects the fact that the CDC has said that people should wear masks indoors in places where there is substantial or high transmission. And if you look at the CDC map, the Bay Area is completely covered by that substantial high orange red zone.
Is that what made today the day where they decided, okay, we've got to move forward?
I think that is partially it. It is also the health officers have been saying that they've just been watching the data, particularly on hospitalizations, that hospitalizations and deaths are a lagging indicator behind COVID case test positivity, and they are seeing hospitals fill up again. They don't want to get to the point where you saw those horrible scenes of different places around the country where hospitals, where ICUs were overwhelmed, but they are saying that they are seeing more people coming into hospital, more people testing positive. And interestingly, they did make the point in this announcement that there are an increasing number of people who are testing positive who are fully vaccinated.
What I find interesting, I think I heard you mention that it was 7 weeks to the day that San Francisco, the Bay Area, a lot of the Bay Area communities rolled back the previous mask mandates. I imagine that had to be a tough thing for the health officials to gather together as they did today and put this mask mandate back in place because we had made such progress.
And if you cast your mind back, it feels like ages ago now to June 15th when the mask mandate was lifted. Prior to that, there were questions being asked, well, if California and the Bay Area are doing so well, why are we waiting that long? June 15th felt like it was going behind the rest of the country in terms of lifting mask mandates. And at the time, we heard the governor and other officials, health officials, saying that they want to see, again, the lagging indicators, make sure that hospital rates are doing well, et cetera. And I had asked doctors around the Bay Area, did we go too soon? And I think what's really happened here is that Delta has just thrown everything a curveball. That what they said in the announcement today, too, was Delta is different. This is just not the same virus that we were dealing with even a month ago, that more data is coming through showing that it really is more contagious, and that the assumptions that were in place when people were talking about looking at the data and figuring out when masks should come off, all of that has changed now, and no one wanted to be in this position. But it's really about protecting the vulnerable people who aren't or can't get vaccinated,
Mm-hmm.
and also acknowledging that it seems that vaccinated people can still get infected and transmit the disease, even though they have a much lower likelihood of doing so.
Right. And it's that component right there, the transmission, that vaccinated people can still transmit the virus, and this much more infectious version, the Delta variant. Over the weekend, and some of the numbers from the CDC study that was leaked that came out and we got information on late last week, the breakthrough cases, I think in 38 states, were 0.08% of the roughly 164.2 million people who've been fully vaccinated. But even if that 0.08% is still able to acquire and transmit the virus, the breakthrough cases probably, I imagine, they obviously changed the calculus for these public health officials.
Yeah, I think that is what it's come down to, that it is this extra level of protection. It's hard to wrap your mind around the numbers when we're talking about breakthrough cases, precisely because the Bay Area is so well vaccinated.
Mm-hmm.
Well, we heard from Marin County that is one of the, best vaccinated places in the country. They have very high vaccination rates, and yet they're seeing breakthrough cases, which sort of makes sense, right? If so many people are vaccinated.
Yeah.
So what they're seeing there is that since April, the proportion of cases that are breakthrough cases in vaccinated people has doubled every month. And you kind of have to really rack your brain a bit to sort of understand proportions and what the number really represents, because they went sort of in a round robin of what is the situation in each county in terms of people who are showing up in hospitals who are fully vaccinated, for example. And the data changes every day, and each county has a little bit of a different picture. But what they had said was that overwhelmingly, first of all, the people who are ending up in hospital are unvaccinated. And of the people who are fully vaccinated who end up in hospital, again, remembering that a lot of the population is vaccinated.
Right.
So you'll have those people, that the people who end up in hospital are elderly or people with severe comorbidities. So then you have this mandate here where they're saying, we told you to get vaccinated, and now that you're vaccinated, we're telling you to keep your mask on. And people might be forgiven for thinking, well, why do I need to do that if I have to wear the mask anyway? And that concurrent message they're trying to give is it still protects you from being very, very sick and dying. We heard from the Sonoma County Health Officer, Dr. Sundari Mays, who said 100% of people in the ICU right now are unvaccinated people who could have gotten the vaccine. They would have been eligible, but seemingly chose not to.
It just is amazing the way that this virus continues to shapeshift, if you will, and to just completely grip every part of our lives. I mean, we're well into a year and a half plus of this thing, and yet here we are, another mask mandate.
And I think there were more bits of advice in there that are not part of the health orders, including, get your vaccine, as you say. But if you're not vaccinated, the health officers were saying, don't go inside where other people may be taking their masks off, because this is not a ban on indoor dining, for example.
Mm-hmm.
You can take your mask off while you're actively eating, and they're not banning people who are not vaccinated from going into the restaurants, but they're saying the advice is don't do that. And likewise, for the very elderly and for people who do have those comorbidities, even if they are fully vaccinated, one of the health officers said, well, my advice would be to stay away from those risky activities. Don't be hanging out indoors in public places.
Makes it tough because, we're right in the middle of summer. They had some data crunching out that we didn't get above 69 degrees for the month of July, but we're going to get a nice warm spell here eventually in the Bay Area, and people are going to want to go outside and going to want to gather.
Yeah. And then, as you said before, there's still this question about, how safe is outdoors?
Mm-hmm.
It still is safer, for sure, is what we are hearing from these experts. But it used to be that we could say, just go outside and you're fine. But there's that extra little caveat now that Delta still has so many questions surrounding it. So if you want to be super safe, you could wear your mask all the time. But I should say that this mandate, as it stands, really is just for indoors.
Be safe out there, Kathy Novak. Thank you very much.
Thank you. You too.
For more on this story and the latest from around the Bay Area every day, stay connected at kcbsradio.com and the Odyssey app.